meal. Avoid also eating late in the night. And then the supplements that we are going to recommend will help with ensuring that you are getting all the nutrients that you require. So we recommend your Life Shake, which you can use to replace one of your meals, especially if you're concerned with portion control. So Neolife Shake will be useful there. Amitone also will be helpful, as well as Neolife Tea. So those three, together with changing some of the lifestyle points in case you are not yet changed them, should be able to help you to progressively reduce your belly fat. In fact, if you eliminate sugar and refined carbohydrates, the change is often quite visible. Maybe 3 weeks, you should be able to start noticing the belly is producing less, protruding less and less. Then next question was someone who gets flu frequently. And as we are moving into the cold weather here in Southern Africa, we are experiencing quite a number of this type of infection. So I always recommend that once the weather the cold weather that tends to make viruses proliferate comes, exposure to sunshine. If you can spend some time in the sun, it's going to be good. And also, when you're well, maybe some exercises and movements would be useful. But I do recommend that when you're sick with flu, do not do vigorous exercises. It tends to prolong the time it takes for you to get over the flu. So when you're well, then include exercise. But if you are ill, let the flu clear up fast, and then you can go back to your exercise program. Supplement with vitamin C and chelated zinc and A plus D. All right, next question was a number of them about cysts. So cysts are unwanted growths that may occur in different organs. Some of them appear on the ovary, some appear in the skin, like you can have some cysts on the face that are associated with acne. You can also have them on the kidney and so on. So in general, there are growths where we do not want there to be growth. And they may be due to blocked ducts. So for example, if the oil ducts in your skin are clogged up, maybe because you're using makeup and not cleaning the skin well, then with time you may end up with the clogged ducts, which can be the place where you start having cysts. It can also be hereditary. It's more common with some people, and it can also be the result of infections. So here we'll recommend cruciferous plus, especially if it's something like PCOS, polycystic ovarian syndrome. We'll also recommend vitamin C, as well as omega-3 salmon oil. Also, just to add, if the cyst, in the case where it is PCOS, then it's recommended that we use botanical balance, because PCOS is closely linked with diabetes or other sugar issues, pre-diabetes, and so on. The next question was someone who had a dislocation in their spine. And this is one where I would recommend that they find a physiotherapist or a chiropractor who specialize in realigning the spinal column, and also to avoid prolonged sitting. A lot of back issues, unless they are as a result of some accidental injury that you get, a lot of the ones that develop slowly are linked to prolonged sitting. So try to get up. If you have a sedentary job, do try to get up from time to time so that you are not in the seated position the entire day. And if it's possible, consult a chiropractor or a physiotherapist. They are going to recommend for you stretches and exercises that will be helpful. Sometime when the problem has become severe, then it may be necessary to have surgical intervention, unfortunately. But if it is still at a stage where you salmon oil to help with to rebuild cartilage, and we recommend Calmag also. So those three would be the recommended products. Then another question was someone who needed hip surgery, probably because of problems with the head of the hip bone, the long bone, of the thigh bone, not the hip bone. So sometimes this happens. It's a common problem, especially for different types of people, but people with sickle cell anemia tend to have this issue. The sickling damages the head of the thigh bone, and with time, the hip can get easily dislocated. Also, with age and injury, this can happen. So I would say that in the case where the head of the thigh bone has been seriously damaged, there may be no great intervention other than preparing for surgery. So I think if the doctor has said that he needs surgery, the X-ray has probably shown that that is the best that they can do. So to prepare for surgery, you can recommend for them chelated zinc, which helps in healing of internal wounds. Recommend vitamin C and vitamin A plus D to help them in recovery after the surgery. Then someone wanted to know what to recommend for hot flashes. This is to do with menopause. One of the most uncomfortable experiences of menopause is hot flashes. And unfortunately, sometimes there will be a good response. Herbal feminine complex works well for some people, not everyone, and Pro-Vitality as well to ensure that they're getting the baseline of supplementation. So if you find that it is not working after 3 months, then maybe you may try something else. Someone wanted to know what to recommend for autoimmune issues. Again, these are the autoimmune problems are becoming more and more common as we are getting exposed to factors that agitate our immune system and cause it to attack our tissues. So on the lifestyle side, I recommend avoid foods that trigger the attacks. There are certain foods that tend to be more problematic than others. So you can try to find out and observe what makes your symptoms worse. So some people react to wheat, some people to sugar, some people to dairy, some people to tomatoes, potatoes, the nightshade family. So try to see if there is anything that if you do or eat makes the symptoms worse, and then avoid it until your immune system settles back down. Eat a healthy diet that has minimally processed foods, especially carbs that contain fiber, because these help to support your gut microbiome. And the gut microbiome plays an important role in boosting our immune system. Then the supplement we'll recommend for the immune system will be phytodefense. If you're not able to buy a phytodefense, does tend to be pricey. So if maybe the budget is tight, you can at least opt for flavonoid complex. And then we also recommend omega-3 salmon oil. We recommend vitamin A plus D. You can also add there zinc or multimineral alfalfa and fiber tablets. If you're not getting enough fiber from your diet, do supplement with fiber tablets. We eat the fiber not for our own needs, but for the needs of our gut microbiomes, which support us in very many ways. One of the most important of which is our immune system. Okay, then someone wanted to know what to recommend for the health of the spleen. So the spleen is a small round organ that is involved in the things to do with our blood circulatory system and so on. And for its health, generally, we recommend vitamin B complex. We recommend multimineral alfalfa, as well as flavonoid complex. Then a number of other questions was to do with fungal infections. So fungal infection on the skin, on the feet, sometimes also ringworms on the head. This is common in children especially. And fungal infections tend to be linked also to blood sugar issues, so diabetes and pre-diabetes, and then insulin resistance as well. We also have link it to a weak immune system. So I think that if someone comes with this issue, you may try to find out if maybe they have got blood sugar issues or immune issues. Also, another reason can be chronic exposure, especially if they are constantly in a warm, moist, poorly ventilated conditions. This is proliferate. Or if they are in continuous contact with someone who is infected, then they can be getting reinfected, especially if their immunity is not very strong. So investigate a little bit. If it's something to do with blood sugar, then the first recommendation will be botanical balance. And then we also will add their threonine. Garlic allium complex is useful for helping the body to fight all these types of infections. And you can also add vitamin A plus D that helps in boosting the immune system. The next question was someone was having pain during urination, and this can be due to maybe an underlying reason. It could be the prostate gland, so it would be good to check the prostate. It could also be good to check type 2 diabetes. And also, it could also be an idea to check sexually transmitted infections. And if it's a case of sexually transmitted infection, then do see a doctor to get antibiotics. And also the partner should accompany so that you do not get a reinfection. Then the supplements we recommend will be flavonoid complex. We recommend cruciferous plus, especially if it's a prostate issue, and recommend garlic allium complex, especially if it's an infection issue. Another question was how to improve blurry vision. So blurry vision can be associated with eye problems such as cataracts. Cataracts can tend to develop as we age, and cataracts have also been linked to blood sugar issues, unfortunately, as well as other reasons. Another problem that can lead to blurry vision would be habitually reading or doing fine work in poor light. So let us say you sew or you do other work that require keen attention, but under poor light, this can progressively lead to deterioration of the vision, as well as other things, including high blood pressure and as I say, diabetes as well. So here we recommend that if you have any underlying condition, then do recommend for them. If this person has any of these underlying conditions that are linked, then I think, for example, if it's someone who has got a family history or has had diabetes themselves or pre-diabetes, then we need to attend to that, because there is no point in focusing on the blurry vision. Meanwhile, the diabetes is wreaking havoc in their other body system together with the eyesight. So if it is either high blood pressure or diabetes or something like that, then I think do get to first attack the root cause. And then in addition, we can recommend vitamin A plus D, omega-3 salmon oil, and carotenoid complex. So this will be help with improving of blood vision. Then a number of people asked about recovery from stroke. So again, here we are dealing with blood and blood circulation health. So the first thing to say is that once a stroke has happened, our aim is to prevent a future stroke, because one of the things that increases the risk of getting a stroke is having had a stroke before. So our aim will be to prevent another stroke from happening. And also, in some cases, we may be able to help with the recovery. But this is not always easily done, because it depends very much on the severity of the stroke and how much damage it has done. So it may be a useful thing to have a rehabilitation, maybe with the help of a physiotherapist or a speech therapist and so on. And the supplements that we will recommend will be lipotropic adjunct, vitamin E, and garlic allium complex. Again, take a note that if you are going to recommend vitamin E, you need to find out whether the person is on blood thinners. So if vitamin E is another one of the supplements that can thin blood. So if the person is on blood thinners, there may be an excessive thinning of the blood. Okay, then someone wanted to know what to recommend for having candida infection during menstrual periods. So sometimes as a result of the hormonal changes that occur in our bodies, we may notice that at the onset of the menses, we get a candida infection. And so here, the lifestyle thing is to avoid junk and starchy, sugary foods. Unfortunately, sometimes as the menses come on, there may be a craving for starchy and sugary food. Try to keep them at a minimum or avoid them altogether. And then we recommend feminine herbal complex. We recommend fiber tablets, and we recommend garlic allium complex. Then I think this would be my last question. As you might hear from my voice, I'm struggling a bit with the flu. So someone wanted to know about an inflamed pancreas. So the pancreas is one of the organs we'll be speaking about as we start talking about going to our next talk about metabolic health. As you may have recalled, I have said we'll have a series of sessions about metabolic health just so that we can see the connection between the different illnesses that are becoming common among us. Things like how is diabetes, high blood pressure, other cardiovascular problems, Alzheimer's, and so on are all linked in one way or another to our metabolic health. But for today, just to mention that pancreatitis is the inflammation of the pancreas, and this can be again linked to other underlying issues. The lifestyle recommendation will be if you are a person who uses alcohol, especially using it heavily, together with tobacco, then this means that the pancreas is being affected by these habits, and it's time to eliminate them from your life. Also opt for minimally processed foods because the pancreas does a lot of work in digestion and energy control. So get yourself a better quality food. That is food which has not been processed a lot. Here in Africa, minimally processed food does tend to be more affordable than excessively processed food. So it is a boon for us. You'll actually save food by having healthier carbohydrates and foods in your diet. Then we recommend that for pancreatitis, recommend ProVitality as well as magnesium complex. If they have sugar issues, which can also be an underlying cause of this, then add their botanical balance. So I will stop there. I want to thank you very much for the time and the data. I hope that you have found the questions that we dealt with today interesting. You will be able to help people who come along to you with some of these issues. As always, if you have a question that you would like to be answered urgently, then you can send it to my phone, my phone or Pascal's, both of which are available at the DSCs. And also allow me to wish you all the best in the forthcoming days of this month, May, as you go for your goals. So
Thank you very much, Betty.